Another great example of this is one of our patients, Alejandra. So I had the privilege of doing an all-on-X procedure on Alejandra. Alejandra is 98 years old, soon to be celebrating her 99th birthday.
Yo tenía muy malos dientes. Ya empezaron a caerse y a ponerme placas removibles y un día las perdí.
So sometimes patients will think, I'm too old to get this done. And this is the perfect example of how it's never too late to get this procedure done.
Y decidí que no no ponerme una placa removible, una placa fija. Además, esta placa no tiene paladar y las otras sí, medio paladar, y como que se le enreda a uno la lengua y no pronuncia bien las palabras. Y además le quita el sabor a la comida, que es muy importante.
Alejandra, unfortunately, has been a patient of ours for a little bit, but unfortunately she came to us with a dental bridge that broke in half, and she only had a few remaining teeth left in her jaw, and she refused to go into a traditional denture. We talked about a couple options. We talked about the pros and cons of dentures or snap-in dentures or fixed teeth, but she was just set on not going into a denture and getting some fixed teeth.
Me hacen reír, que no siento dolor, no, nada de dolor.
So we decided to move forward for her on this procedure, and she has never been happier. She recently just celebrated her 99th birthday, and like I said, her smile is ear to ear. In just one day, we were able to get this done for her. When you do other options like dentures or snap-in dentures, it's multiple visits here in the office, and that's tough for somebody like Alejandra, who's 98 years old. You know, you don't want to have a patient come into your office 10, 12, 15 times. And with the ability of us being able to do this for her in a day, I know in my heart that it was the right decision for her.
El trato aquí ha sido maravilloso. Siempre riéndose y yo también risa y risa.